हम अब क्लास स्टार्ट कर रहे हैं 8 o'clock हो गई।
Bismillahirrahmanirrahim. The quote of the day is never stop learning because life never stops teaching. The topic of today's presentation is monitoring and evaluation of public health programs under the supervision of Professor Dr. Saira Afzal. The learning outlines of today's presentation is what is monitoring and evaluation, a brief overview of indicators, variables and objectives, levels of monitoring and evaluation, the logical framework, objectives of program evaluation, standards for effective evaluation, steps in getting answers to evaluation questions, data collection methods and threats to internal and external validity of an evaluation, and at the end are recent advances and MCQs. By the end of this presentation, participants will be able to describe what is monitoring and evaluation, levels of monitoring and evaluation, the logical framework, objectives of program evaluation, standards for effective evaluation, steps in getting answers to evaluation questions, and data collection methods. Now, the overview of monitoring and evaluation. Monitoring and evaluation is an essential management tools to assess health programs and services. It helps to ensure that health activities are implemented as planned and to assess whether desired results are being achieved. It is important to improve the performance of those responsible for implementing the services and whether a service or program is accomplishing its goals or not, and it identifies program weaknesses and strengths. And if it is used well, monitoring and evaluation can become a powerful tool for social and political change. Now, what is monitoring? Monitoring is the routine tracking of key elements of program performance, usually inputs and outputs through record keeping, regular reporting and surveillance system, as well as health facility observation and client surveys. Monitoring is continuous internal process conducted by managers to check the process of development interventions against the predefined objectives and plan. Evaluation normally takes place when a program or project has finished. The evaluation will answer the specific questions related to the relevance, effectiveness, efficiency, impact, and sustainability of the completed development activity. Now a brief overview of the indicators. An indicator is a variable for measuring the achievement of objectives. Indicators are measurable that can be used to help describe a situation that exists and to measure changes or trends over a period of time. A function of indicator is to indicate good or bad for that variable. It can be quantitative, such as the infant mortality rate or the maternal mortality rate, or it can be qualitative, such as the place of birth. Key performance indicators should be clear, such as it means that it should be unambiguous, that are understandable. It should be relevant, meaning appropriate for the measurement, and it should be economic, meaning available at a reasonable cost, and it should be adequate, meaning sufficient to assess performance, and monitoring, meaning amenable to validation. A variable is a characteristic of interest that has different values for different objects and subjects. It can be qualitative or quantitative and can be a binary variable. A binary variable is the variable where the response is one of the two alternatives. For example, in gender, the gender is the male or a female. Now the objectives. Objectives refers to short, medium, and long-term challenges desired for beneficiaries or their environment, and it is expressed in form of statement. Objectives tend to be more specific than goals and are required to be SMART. Now what denotes for SMART? It is specific, measurable, achievable, relevant, and time-bound. It should be specific and clearly mentioning the situation that needs to be changed. The performance target is clearly written to avoid different interpretations, and it should be measurable. The target roles are team to monitor and evaluate progress towards achieving its results. One should be able to quantify or verify how much change has occurred. and it is achievable. Information must be collected at a responsive, reasonable time and cost, and it is in line with the scope of program activities so that it can have influence or make changes. And relevant to the need of people who would use it, and the objective and the question is that can the objective be achieved with the available resources, and it should be time bound. The performance target has a specific time period for completion, and it has the so that it has the influence over the decision making. Now the levels of monitoring and evaluation. In monitoring and evaluation, that is called the logical framework or monitoring and evaluation framework. It is a management tool that is used to simplify and improve the design of interventions in relation to its key components. It is also known as result chain as each step leads to next step in achievement of goal. It provides a streamlined linear interpretation of a project's panel, use of resources and its desired ends. There, there are 5 levels in logical framework. These levels are discussed one by one. First one is the input. Inputs are essential. Essentially, the resources are things that must be put in or invested in order for activities to take place. The next level is processes. These are the activities carried out to achieve the program objectives. The next level is output. The immediate results achieved at the program level through the execution of activities. Outputs are short-term development results produced by project and non-project activities. They must be achieved with the resources provided and within the time frame specified. And it should mostly less than the 5 years. The next level is outcome. Outcomes are actual or intended changes in development conditions that interventions are seeking to support. The last level is the goal. It is a broad term denoting the long-term effects or end results of the program. For example, changes in health status. In this context, the term impact refers to the health status or conditions that the health program is intended to ultimately influence, such as mortality, morbidity, fertility, and etc. And it is measured by appropriate indicators. Now here is a flowchart diagram of a logical framework of acute respiratory tract infection example with the examples of management and clinical examples. The first level is the input, in which funds, staff, vehicles, other resources needed to carry out the program are utilized. In the example of management, for example, for acute respiratory infections, a fund of $250,000 for regional stores are required, and in the clinical example, the staff required is 3 clinicals experience in acute respiratory infection treatments. Next level is processes, in which management activities and clinical protocols and training of the staff is done. In management example of is plan for construction of regional stores, and in clinical example, it is the training course developed on acute respiratory infections. The next level is output. In this, the number of services or activities completed and medicines are delivered and staffs are trained. In this example, there are 3 regional stores that are constructed and 1200 health workers are trained. The next level is outcome. In this, immediate changes in medicine availability, medicine quality, rational medicines are used. The example is that the drug availability is increased to 80% and 80% of acute respiratory infections patients are correctly treated. The last step is impact or the goal. That are the long-term changes in health status. And the goal that is achieved or the impact is that reduce the acute respiratory infection mortality. Now here is an example of a logical framework of HIV. In this, the inputs that is the personal funds and other resources. In HIV, we need the financial resources and VCT protocol, human resources, and HIV test kits. And the process is provide pre-test counseling, provide HIV testing, provide post-test counseling, and in outputs, we will have people that have learned their HIV status. And then is the outcome that the client develop personal HIV risk reduction strategies and risky behaviors are decreased. And at the end is the impact that is our goal. HIV transmission rate has been decreased and the incidence has also been decreased and HIV morbidity and mortality decreases. Whole logical framework have the program managers. It plan with the ends and goals in mind, decide what is essential and what is not, describe project to others in simple and visual way, describe the causal pathway from activities to goals, make an effective and efficient monitoring and evaluation. Know the objectives of program evaluation that are to learn the lesson and accountability. To help the government, policymakers and managers, development partners and researchers to learn from the experience through discovering whether particular development interventions have worked or not, and through understanding why they have not relatively successful or unsuccessful in particular contexts. And next is the accountability. to account for the use of resources to funders, the parliaments and taxpayers and the beneficiaries in whose names the funds are raised and used. Next is the type of evaluation by by the timing of evaluation and by the process of evaluation. These are further discussed in detail. Types by timing of evaluation. In this, these are formative, midterm, and summative evaluation. In formative evaluation, it is intended to improve the performance, most often conducted during the implementation phase of the program. And in midterm or review evaluation, evaluation performed towards the middle of the period of the implementation of intervention. And in summative evaluation, it is conducted at the end of the intervention to determine the extent to which anticipated outcomes were performed. It provides information about the worth of the program. Know the types by process of evaluation, which are 5 types. Now, first type is self-evaluation. It is done by those who are entrusted with the design and delivery of a development intervention. Next type is participatory evaluation. In there is a method in which representatives of agencies and stakeholders, including beneficiaries, work together in designing, carrying out, and interpreting an evaluation. Next is the process evaluation. It is an evaluation of internal dynamics of implementing organizations, their policy instruments, their service delivery mechanisms, their management practices, and linkages among these. Next is the joint evaluation. It is done by donor agencies or partners in which they participate. Next is the meta evaluation. It is used for evaluation designed to aggregate findings from a series of evaluations. It can also be used to denote the evaluation of an evaluation to judge its quality and assess the performance of evaluators. Now the last type is independent evaluation. It is also called the third-party evaluation, and it is carried out by entities and persons free of the control of those responsible for the design and implementation of the development intervention. The credibility of an evaluation depends in part on how independently it has been carried out. Independence implies freedom from political influence and organizational pressure. It is characterized by full access to inform and by full autonomy in carrying out investigations and report findings. Now the steps in evaluation process. I will give only the names here because these are already discussed in yesterday's presentation. The first step is engage the stakeholders. Second step is describe the program. Third step is focus the evaluation design. Fourth step is gather credible evidence. Fifth step is justify conclusions. And sixth step is ensure use and share lessons learned. Now the program evaluation worksheet, that is the matrix. The matrix is completed by the evaluation team members after they have thoroughly described the program after in-depth inception meetings with stakeholders, literature review, and brainstorming. The matrix once completed will be guiding force as to where the evaluation is heading. It has information on what are the important evaluation questions, what indicators would be needed to answer those questions, timing of data collection, sources of information, methods of information gathering, sample tools and instruments needed, and how will the data be analyzed, how the data will be interpreted, and finally how the evaluation findings would be disseminated to stakeholders. This is a sample of evaluation worksheet which the evaluation persons will use to, to complete their evaluation in a specified program. Now the standards for effective evaluation. There are certain standards for assessing the quality of evaluation activities. The program evaluation standards make conducting sound and fair evaluation practical by providing guidelines. The evaluation process should be impartial and independent. Now the criteria for good evaluation standards. It should be relevant, effectiveness, efficient, impact, and sustainability. In relevance, the extent to which the objectives of a development intervention are consistent with the beneficiaries' requirements, continuous global priorities, partners and donor policies, and are its goals and objectives are appropriate to present circumstances of the country. Next is the effectiveness. In this, the extent to which the development of intervention objectives were achieved or are expected to be achieved. In it, there's a question that is it achieving satisfactory progress towards its stated goals and objectives, and it also builds the reasons for successes and failures of the programs. Next is the efficiency. It is a measure of how economically resources are inputs, funds, expertise, and times are converted to results. and are the effects of the program being achieved at an acceptable cost compared with alternative approaches to providing the same services. Next is the impact. The positive and negative, primary and secondary, long-term effects produced by a development intervention directly and indirectly, intended or unintended. And it also generates, does the program appear to be achieving its long-term health benefits? And at the last is the sustainability. In sustainability, there is the continuation of benefits from a development intervention after the major development assistance has been completed. The probability of continued long-term benefits. In financially and institutionally, can the program continue with the present level of local inputs? Next is assembling an evaluation team. The team leader will manage the team and evaluation process and act as the same prime interface with the evaluation manager who represents the commissioning partners. The commissioning partner is the agency which provides the funding for evaluation. Team members of the evaluation are selected for their technical skills, knowledge and experience, and their local understanding. Ideally, they would have the experience of evaluation techniques. The example is team for evaluation of tuberculosis control program should have the team leader, that is the evaluation expert, and the team members are epidemiologist, laboratory expert, drug logistics, supply chain expert, financial management expert, HR manager experts, survey team for field data collection consisting of trained males and females. The team members would be all local or mix of local and international team members. Now the steps of functioning of evaluation team. The first step is write a proposal for evaluation based on terms of reference by commissioning partners. Second step is inception period for contact evaluation team to plan and detail methodology and logistics for conducting evaluation. Third step is to perform data collection, document reviews, questionnaires, interviews, and visits. Fourth step is report preparation, drafting, consultations on draft and report finalization. Fifth step is final agreement on report, follow-up and official responses to recommendations, translation, publication, and dissemination. Now the steps in getting answer to the evaluation questions. First step is to translate general evaluation criteria into specific evaluation questions, make evaluation questions operational by turning them into evaluation instruments, determine the information collection method for each instrument. Some information is qualitative while other is quantitative. Some information is collected by face-to-face interview while other through the observation checklist. The gathered information is put in software, data is analyzed and aggregated, answers to the evaluation questions are obtained, conclusions are drawn based on obtained answers, linking them to evaluation criteria. Based on above conclusions, main recommendations are written. Findings are disseminated to identified audience. Now the data collection methods. Data collection methods should be multiple. For instance, the methods of data collection that could be employed in evaluation TB control program are literature research, data reports, surveys, and research articles, health facility survey, client survey, treatment defaulter survey, key informant interview of primary healthcare facility in charge, key informative interview of district TB coordinator, household survey of knowledge, attitude, and practices about TB and service availability, focus group description of lady health workers observing dots, qualitative and quantitative data analysis in evaluation. The evaluator needs to use supplementary methods that maintain a reasonable level of precision without being too time-consuming and expensive. The concept of triangulation is used to bring together data on same topic from several different sources. Both qualitative and quantitative data collection and analysis techniques should be employed in varying proportion as they provide means of triangulation. It is worthwhile to decide in a planning stage as to which software should be used for qualitative and quantitative data analysis. Quantitative data collection involves a planning stage of utilizing appropriate sampling and sample size for the evaluation. The purpose of qualitative data analysis is to present the data in structured format using tabulations such as frequency, percentage, and graphs, and to investigate association between independent and dependent variables, and to generalize findings to populations. Qualitative data includes detailed descriptions, text quotations in response to open-ended questions, the transcript of opinion of groups, and observation of different types. The analysis of qualitative data helps not only to broaden the view of phenomena of interest in an evaluation, but can also increase the depth and detail where needed. Know the threats to internal validation of an evaluation. The evaluation team must give a due consideration to factors which can affect the internal validity of an evaluation. First one is the history. An event occurs unrelated to the intervention during the evaluation period. Next is the maturation. And this is the systemic changes that occur normally among the population. For example, due to aging with time, people themselves approach the health centers rather than due to awareness raising campaign on the program. Next is the selection bias. Selection bias can arise in an evaluation if the study population or the control population both are selected using non-random techniques. Next is the statistical approach. In this, our program implies a study population that is selected because of the qualities that are above or below the population as a whole. Then these outlines likely to regress back towards the mean of the own accord. Next is the attrition. People in intervention or comparison group are more likely to drop out of a program. In this example, healthier people drop out of a program because they feel it does not apply to them. Next is the threats to the external validity of an evaluation. In this, there is selection. First is the selection intervention interaction. The outcomes are valid not only to selected populations, and next is the Hawthorne effect. If the subjects are aware that they are in an experiment or an intervention, they try harder, known as Hawthorne effect. As a result, augmented outcomes obtained are not necessarily the result of the intervention. Next is the multiple intervention effect. The reason the program worked in a particular area might be that other supportive programs were working in the same area. Know the recent advances. The first article is the role of monitoring and supervision to improve health services delivery in basic health units of Punjab in Pakistan. Punjab has successfully developed and implemented e-monitoring system by providing Android phones to all district levels managers, including executive district officers, district health officers, and deputy district health officers. Health Watch, it is also called Health Watch, and it is being implemented successfully in all 36 districts of Punjab. It provides a real-time data about availability of health facility staff, medicines, and functional equipment, and improvement service delivery indicators are being captured and reflected on a dashboard managed by Punjab Information Technology Board. In order to validate and verify the data collected by the district level health managers, a second tier of monitoring and evaluation was introduced by hiring of 172 monitoring evaluation assistants that are called MEAs to monitor the primary health care facilities on the same dataset. The paper shows that that field monitoring and validation of field monitoring through MEAs is bringing an improvement in service delivery indicators of basic health units. A real-time data of all BHUs of 36 districts of Punjab has been taken into account. A quantitative comparison of health-wide data and MEAs data has been made to assess situation of stock, position of medicine, availability of functional equipment, staff absenteeism, and service delivery indicators. Subsequently, evidence generated through the Health Watch and MEAs data are used to develop appropriate strategies to address the bottlenecks. It has been shown that there is positive relationship between the results achieved and resources used. This paper aims to provide a future course of action to strengthen the MEAs and health-wide data to be used for planning and policy making. The next article is a survey of monitoring and evaluation systems for government projects in Tanzania, a case of health project. In this article, it is stated that currently the Ministry of Health in Tanzania monitors and evaluates its project manually. Due to this, they face the risks and challenges. Monitoring and evaluation staff spend a lot of time in manual work. Data is lost, but in primary strategies, that is lost by shifting the data from primary registers to monthly and annual summaries. No early alert information system in manual reporting of the data, and development of web-based monitoring and evaluation system for Ministry of Health projects will provide timely, accurate information that for tracking the implementation. Now the term for MCQs. First MCQ is, in a district XYZ, there is an increased neonatal mortality rate. A new health program is initiated to reduce neonatal mortality rate by 20%. To achieve it, one of its objectives is to increase the proportion of birth attended by skilled birth attendant from 40% to 80%. The objective is not well defined in it because whether it is not measurable, cannot be achieved, not relevant to the needs of people, or it is not time bound. Which one is the correct option?
No time bound. D.
Yes, D is the
D.
correct option because the objective has not clearly defined the time period. The objective will be clearly defined if the time has been shown in it. The next MCQ is to improve the maternal survival in rural areas, training of community midwives, training of healthcare providers on EMOC, and health education of women on danger signs in pregnancy is conducted. This is which level of monitoring and evaluation?
Inputs. A.
B process.
B is the correct option, processes, because in processes the training of the staff is done. The third MCQ is to cope with the ongoing COVID-19 pandemic in a country XYZ. 4,000 doctors, nurses, and paramedics has been trained for vaccination against COVID-19. This is which level of logical framework?
Process. Alpha.
Outputs.
No, yes, output is the correct option because in output uh, the training of the staff has been accomplished and the staff is trained. No. And the fourth MCQ is there is an increased number of deaths in an area which are got affected by flood. To reduce the mortality due to diarrhea in children, antibiotics, IV fluids, syrup, zinc, and ORS has been delivered to that area to address the prevailing situation. This is which level of logical framework?
Output.
Yes, output is the correct answer because in output along the training of the staff has also been accomplished and the medicines that has to be delivered has also been delivered. Now the fifth MCQ is there is an increasing number of deaths in an area which got affected by flood. To reduce the mortality due to diarrhea in children, antibiotics, IV fluid, syrup, zinc, and ORS has been made available to 60% of children, and 30 children are correctly treated. This is which level of logical framework?
Outcome. Utilization. Utilization.
The outcome. The outcome is the correct option because in outcomes the service becomes available to the people and the services that has to be provided are delivered to the people that they can consume. Sixth MCQ is to eradicate polio from Pakistan. 200 people are recruited and a budget of 20 million rupees are allocated in a district XYZ. This is which level of logical framework?
Input.
Yes, input is a correct answer because in input the staff is recruited and the funds are allocated. Seventh MCQ is provision of comprehensive healthcare services to women of reproductive age group in order to improve maternal survival and reduce maternal mortality ratio by 20% in 5 years. Falls at which level of logical method?
D.
Yes, it is a
Outcome.
yes, it is a outcome because it is a long term.
Planning.
Eighth MCQ is after a period of 2 years, evaluation is done and it is noted that in a BHU XYZ there is an increased number of deliveries conducted in that BHU from 30 to 45 deliveries per month by providing the facility of LHV round the clock. The same target can be achieved in future if policymakers give the facility of availability of LHV 24/7 in that BHU. Which criteria of evaluation standard is this? Whether it is effectiveness, efficiency, impact, or sustainability? It is sustainability. Option D is the correct answer because in this if the financially and institutionally program continue with the present level of local inputs, then it is the sustainability. Ninth MCQ is for evaluation process to be independent. Independence can be achieved where evaluation activities are independent from all of the following except whether stakeholders who invest in conduction of evaluation, managers having interest in good performance, or the political interference or the organizational pressure. Option A is the correct answer because stakeholders who invest in conduction of evaluation can participate in evaluation, and this doesn't come under the independent. An initiative to promote nutrition rehabilitation of malnourished children in rural areas requires support from the local government, community leaders, and business owners. They are identified and contacted. Within a logical framework, it would be classified as a milestone, outcome, input, or indicator.
Input.
Yes, input. Input is the correct answer. This is the key to MCQs. Here are the references, and thank you very much.
Okay, thank you very much, Dr. Awais. As far as this